Dear friends, welcome back. Welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you're watching this video for the first time, you come across my channel for the first time, my name is Anastasia Uvarova and I'm qualified, certified and practicing pelvic floor physiotherapist here in sunny Cyprus and also online. Here in my studio, I film YouTube videos for you, sharing my professional experiences, probably cases, interesting cases that inspired me to share some information with you and I have come across in my practice. This particular video today will be for pregnant moms-to-be, but bear with me because I will talk about a very specific device that is called TENS machine. And for the simplicity purpose, I will make several videos on the different conditions that TENS can help with, but not to overload one single take. I will talk today about pregnancy and particularly TENS machine in birth. However, make sure you check out my other videos on TENS machine and how they can help in other pelvic conditions. Comments, let me know, have you ever heard about TENS machine in labor? Maybe you used one. How it is the policy in your country, and is it common thing, is it not so common thing? And let's begin. I will try to be really user-friendly today and use user-friendly language. I'm not going to dive very deep into physiology and chemistry even behind how the TENS machine works, but I'm going to give you basics so that you understand. Before I start, let me explain a little bit what TENS means, how it looks like, how it works, and also how it works particularly in labor and what effect it has on pain. So TENS stands for transdermal, so through the skin, electrical as it is, electricity signals, transcutaneous electrical neural stimulation of the nerves. We have nerves throughout our bodies, throughout our skin, and there are different type of signals that our body perceives. Some are called so-called nociceptive. So these are pain perception. When we get hit, when we have something hot or something cold, so cold burn, some signals that are saying, wow, this is not safe, this is hurting us, this is not good. And normoceptive is that pleasant touch. When we hit ourselves and we rub, we try to add a normoceptive, a normal touch to our body. When we receive massage, when somebody just gives us a nice gentle touch. So all the pleasant touch sensation that we receive through our skin, so transdermal, it's called normoceptive. So these two, the nociceptive, the pain sensation, the pain receptors in the skin, sending signal to our brain, and the normoceptive, the normal, the pleasant, the nice sensation, the sensation of warmth, probably hot pack, something like this, that sends the signal to our brain, wow, this feels nice, this feels good. And this is the principle that TENS machine works in labor. This is how it works, so let me give you a little basic background. There are two ways how the TENS machine works. First, the electrical signal that is going through the skin, that is coming through the patches that we will apply in a bit. Okay, so this signal from the machine, electrical signal, is influencing specific type of fibers that are called alpha fibers. You don't have to worry about them too much. And what is happening is essentially a race between the signals. The painful signal, which is usually the labor contraction, is traveling to our brain and we perceive it. And the normal signal, the stimulation through the alpha receptors, alpha neural pathways, is also traveling to our brain. So these two are kind of competing, and the alpha stimulation that is getting the alpha nerve pathways that are getting stimulated by machine, they're competing with the painful receptors and trying to trick our brain essentially not to feel pain or feel less pain. Now, this is not your switch off button, okay? And I will talk about it a little bit later. But this is essentially how it works. And this happens immediately. So these are very fast receptors. There's a very fast signal. You turn it on, you kind of feel better. Now, there is a secondary mechanism, which is endorphin mechanism. If we have the machine for more than roughly 30 minutes, then it also stimulates our central nervous system that starts releasing endorphins. Endorphins are the happy hormones. The happy hormones that are also working on our pain levels. And this is why quite often after birth, if you did not have any painkillers, the mother might feel this rush of excitement and kind of forget about the pain because of adrenaline and endorphins when seeing the baby. All right, so 2 ways how it works. A fast overtake of the painful signals, competing with the painful signals through alpha fibers, and endorphin central nervous mechanism that needs a little bit more time. Talking about the actual machine. Mine particular here is very popular L10s. I would like to give a disclaimer that this is not an advert. I'm not getting paid by L10s and I did not receive this as a gift. I purchased the machines, but you can use any other TENS machine, taking into consideration one thing: it has to be easy to use. And this is the good thing about TENS machines that are made specifically for birth. You don't want to fiddle with the buttons whilst you are in the contractions. You know that you press one button and another button, max 2 buttons, okay? Or you get a person that is actually helping you. It can be your spouse, it can be doula, it can be midwife, whoever you make your plan with to help you with the machine. So this particular L10s, they are designed for birth, and this is why design is simple, easy to hold. It has a little wire to put on your neck so you can walk around as well. Turn it on. It has 4 settings. It has boost and burst. The difference is, plainly speaking, when you have a burst, the signal, the perception is a bit of gentle waves, up and down. It can be bigger waves, shorter waves, but it generally wave type. All right, and this kind of signal you might use between the contractions. The boost one, again, I'm giving you just analogy because maybe you will want to use another machine, and since you can't feel it through the screen, I'm trying to give you the best analogy. It's very small and fast waves, and it's continuous, so you need to override pain signal quicker. Okay, you need to go zzz, you need to override it faster, so therefore there is this boost. However, I always say to women, try before and see what works. And honestly, sometimes any of these can work and sometimes none can work. And I will talk about it in a bit again. Let's just get back to technicalities here. And then I will talk about what TENS is and is. So usually TENS comes with four pathways, 4 wires. And quite large stickers, okay? These are not your tiny stickers because these will need to go and stick. I will show you where. You can also see in the picture here and here, essentially covering your whole back, because this is where all the nerves supply your belly, your uterus, okay, all this area. So if I would to put it here, I would stick one here, maybe even a little bit higher. So if I just take it off for a sec, put it on I'm not gonna get too undressed in here, so quite low. And this one would go around here, okay? And you usually get a book that gives you description. And of course, on the same side, on the other side, okay? So this would be your sticking position. When is the good time to start? The good time to start TENS machine when you're in labor is to start early. So you get used to the sensation, you get used to them using the machine, okay? Maybe when you're already kind of getting into that deeper breathing, focus contractions, larger dilation, you still can use it, but you might need to have some help. So I would suggest, number 1, to try it before. It is by protocol allowed to use and try TENS machine after 37 weeks. There is a very tiny chance of anything premature happening by stimulation from the TENS machines. However, for safety reasons, and this is explicitly stating in a pack, and I'm telling you now in case you get non-birth TENS, 37 weeks plus, you're allowed to try it on. If you wish, you can put it on your hand. If mom comes earlier, I usually put it on her hand and she can try the sensation. So try it before, start early contractions. You might want to go throughout with it. You might not want to at some point. Getting to that some point, I had cases where women were so excited to use TENS machine, they rented it out, we went through the whole process, and at the day of the birth, they just did not want to have it on them. And this is absolutely fine and normal, okay? You don't have to, of course. You can try, you can use that far. I had cases where mothers eventually went for a cesarean section and they used TENS machine on their back post-cesarean for pain relief, or they used TENS machine to a certain extent for pain relief, and then for XYZ reasons they had to go for a C-section. All the scenarios are absolutely valid, and there is no right and wrong. If you have it, you don't have to use it, or maybe you have it just in case and you end up using it. Number 2, your TENS machine is not your epidural. It will not give you as much pain relief as epidural overall. However, I had clients who really felt that it gave them very much enough pain relief to take it through labor without epidural. This is what they wanted. This was their wish. This is what they did. I had moms who took their epidural time and delayed it slightly because of TENS machine. Yes, they wanted epidural. They did not want it at the 1 centimeter dilation. They wanted to be as mobile as possible and then get it, at the latest point possible, which is usually around 6 centimeters. After that, maybe not. It depends really on circumstances. Also, one thing I need to say, safety-wise, generally it's a very safe device. It's operated on batteries, okay, but it's not suitable for water birth. It is not suitable. It has to be on a dry land. You cannot go with a TENS partially or anyhow anywhere near water. It has to be dry land. If you decide to use it before getting into bath tube, that's fine. You completely remove the machine, you go on with your water relief. You want to do it after, you must make sure your skin is nice and dry. You stick the machine and you don't go to the water again. So this machine and water during labor, and generally in any case, do not match. Okay, this is not for water. When I rent the TENS, I'm very, very clear that this might be great, but do not expect it to be a complete pain relief. So have plan B if you really think that you might need some other pain relief, or be disappointed, oh, it didn't work, I expected no pain, I expected complete, freedom of movement and just chill back birth, and it didn't happen. Every single nervous system is different, every single body is different, how we perceive pain is different. And after birth, you just remove it, put the stickers back, and that's about it. And you can use it also for pain relief after birth, whether you had C-section, whether you had vaginal birth and maybe you're sore down there, you can put it exactly again at the same place and even use it for back pain relief. Some moms might have back pain, exactly same place on your back. It's safe. You don't put it anywhere around your tummy, not in the hospital, definitely not, but around your back it's absolutely safe to use. It does not influence in any negative way your pregnancy in case you decide to try it during pregnancy, before the labor. After 37 weeks, just to be on the safe side. Hope that helped. I did not dive deeply into settings here on this particular machine because, as I said, my point was not here to advertise this particular product, because maybe it's not available to you, maybe something else is available to you, but L10s, baby care 10s, it's a great product. As I said, not a paid advert, not a gifted. But you can use any type of TENS machine. Make sure you try it before. You do not go without trying TENS machine into the labor. You must try it, you must be confident. how to press the setting, how to use the button, how to make the wave stronger, less stronger, because you will lose your sensitivity slower over the time. So you have to be really confident on how to work the machine, or your partner has to be able, whoever is your birthing partner, to pick on it and help you out. I hope this really helped. And as I said, I will use TENS machine for other conditions, so keep watching this space. But for the simplicity of it, we talk only a labor about today. I hope you all have great birthing experiences. However it turns out, you're respected, you're having your choices, you're giving explanations, and really just have a positive birthing experience. Thank you so much for watching. Thank you so much for liking this video, and we will see you back very soon. Bye.